All right, let's dive into a topic that can be really scary and is so often misunderstood. Harm OCD. For anyone going through this, it can feel like you're completely alone. But understanding it, that's really the first step toward compassion and, most importantly, getting better. So, here's how we're going to break it all down. First, we'll define what harm OCD actually is. Then, we'll get into why these thoughts happen in the first place. We'll look at the cycle that keeps a person stuck, cover the single most important fact you need to know, and wrap up by looking at the real, hopeful path to recovery.
Just imagine you're holding a newborn, a baby you love more than anything in the world, and out of nowhere, that thought just flashes in your mind. It's horrifying, it's completely unwanted, and it's a perfect example of the kind of intrusive thought that defines harm OCD.
Okay, so what exactly is this condition that can make your own mind feel like the most dangerous place to be? Let's get a really clear definition on the table. So, harm OCD is a specific type of obsessive-compulsive disorder. And the key words here, the ones that matter most, are intrusive and unwanted. These are not fantasies, they're not desires, they are terrifying mental pop-ups that are the absolute opposite of what a person truly believes and values, and man, do they cause a ton of fear and panic. To really get how this works, let's put ourselves in a super common situation. Just picture it, you're behind the wheel of your car, just driving down the street like any other day. And then, bam, that awful idea just appears in your head, and it feels so real. It feels like this sudden, dangerous possibility, like you're about to lose all control, and your anxiety just goes through the roof. So what's the fallout from a thought like that? Well, the person might just stop driving completely, or they might develop this desperate need, a compulsion, to constantly check and recheck, driving back to make sure they didn't hit someone without realizing it. It's all about trying to get rid of that awful uncertainty. Here's another one. A totally normal, everyday situation that can turn into a place of intense fear, like just making dinner with your family nearby. You've just chopped some vegetables, and this image flashes in your mind, an image of using that knife to hurt someone you love dearly. Now, for someone with harm OCD, that doesn't feel like a random thought. It feels like a real, dangerous impulse that they have to fight with everything they've got. And the reaction? Again, it's often avoidance. They might stop cooking altogether, or hide all the sharp knives, or just make sure they're never alone in the kitchen with their family. Little by little, the disorder makes their world smaller and smaller. I know this all sounds absolutely terrifying, so the big question is, why? Why on earth does a brain do this? Well, the good news is there are clear reasons for it. This isn't some kind of character flaw, it's a medical condition. Well, research points to a few main things. It's often linked to other anxiety issues or even chemical imbalances. Basically, the brain's messaging system gets a little scrambled. Sometimes it's tied to this overblown sense of responsibility, this deep feeling that you have to be in control of everything to keep people safe. And past trauma can also play a role, kind of putting the brain's threat detector on high alert.
But here's the absolute core of it. Everybody has weird, random, passing thoughts. The difference for someone with harm OCD is that their brain's alarm system misfires. It takes a totally meaningless thought that would just float by for someone else, and it flags it as a serious, urgent threat. It's basically like the smoke alarm screaming its head off because you burnt a piece of toast. It's a false alarm that feels terrifyingly real.
So this is the really crucial part. How do these thoughts get so powerful? Well, it's not actually the thought itself. It's the reaction to the thought that creates this vicious cycle. Let's break down exactly how this trap works. Okay, so it starts with the intrusive thought. That thought immediately creates intense anxiety. So to make that awful feeling go away, the person does a compulsion, like avoiding the knives or asking for reassurance. And for a moment, they get some temporary relief. But that relief, that's the trap. It teaches the brain, hey, that worked. Let's do that again next time. And so the cycle just gets stronger and stronger. And these compulsions can look like a lot of different things. We've talked about avoidance, that's a huge one, but another is constantly asking people, I'm a good person, right? I would never hurt anyone, would I? Others might hide anything that could possibly be used as a weapon, or spend hours mentally replaying events just to check that they didn't cause any harm.
Okay, we've defined the problem, we've looked at the causes, we understand the cycle. Now we've arrived at the single most important, most reassuring piece of information in this entire explainer, so please really lean in for this one. So let's just ask the question that the person suffering from this is absolutely terrified of. The question that's probably on your mind too. Does having these thoughts mean a person is dangerous?
The answer is a loud, clear, absolute no.
And this right here is why.
The very fact that these thoughts cause so much distress, so much horror and guilt is the proof that they are not real desires. People with Harm OCD are fighting these thoughts with every fiber of their being, precisely because they care so much about safety and love. The thoughts are what experts call ego-dystonic, which is just a fancy way of saying they are the total opposite of who the person truly is.
Now, knowing that brings a huge amount of relief, but it doesn't magically make the thoughts disappear. So for our final and most crucial part of this journey, let's talk about the path forward, because there is so much hope and there are incredibly effective treatments out there.
The gold standard, the most effective therapy, is something called exposure and response prevention, or ERP. The whole idea is to gradually face the feared thoughts without doing the compulsions. This actually retrains the brain to learn that these thoughts are just noise, they're not real threats. This is often paired with things like medication to help manage the anxiety, and mindfulness to learn how to just observe thoughts without judging them. The whole key is to break the cycle, and with the right help, recovery isn't just possible, it's likely. So we'll end on this question. Harm OCD loves secrecy, and it thrives on shame. By understanding that these are just thoughts, not intentions, and that this is a treatable medical condition, not some kind of character flaw, we can create a world where people feel safe enough to finally ask for the help they so desperately need and deserve.